According to the mainstream medical and pharmaceutical world, type 2 diabetes is a chronic progressive disease that is not reversible. And as a result, diabetes requires pharmaceutical drugs to control the disease so that it does not lead to severe symptoms and eventually death. What you are going to learn today is everything I just said is absolutely true. Unless, of course, you're willing to change your lifestyle with nutrition and exercise, then all of a sudden, type 2 diabetes is no longer chronic and progressive, but instead can even be reversed in as little as 60 days. Welcome to the Foundational Health Podcast, where we provide education and inspiration to help guide you on your journey to look better, feel better, and most importantly, heal better. Hello, and welcome to the Foundational Health Podcast. I'm Dr. Kevin Schultz, and today we're going to talk about how you absolutely, positively can reverse type 2 diabetes and safely get off of your medications, if that is something that you desire to do. Because the medications simply will no longer be needed, and many people can do that in 60 days or less. The intent of the podcast today is to educate you on what type 2 diabetes is, how people develop type 2 diabetes, and then most importantly, regardless of what you've been told, how you can reverse it by healing your body from the inside out with some very basic lifestyle changes. We're not talking about anything crazy, drastic. It's pretty basic stuff, and I think you're going to be amazed by that. And also be sure to stick around to the end, because at the end, I'm going to break down one of the many, many flawed studies that are out there and why you need to be careful who you trust, who you listen to. And I'll also give you some quick overview of the simple steps that you can take to reverse and heal from prediabetes, type 2 diabetes, and then, believe it or not, even improve type 1 diabetes and how your body functions with that. So before we jump into the podcast content today, I have a favor to ask. On whatever platform you're listening to right now, please hit the pause button in just a second, and then like and subscribe to the Foundational Health Podcast. Our mission at Foundational Health is to be a voice of truth and to help people realize that being healthy does not have to be hard. It can actually be fun. So when you like and subscribe, more people get exposed to our content, and we get to carry out our mission to a wider audience and help more people. Okay, we're going to start today by looking at some pretty depressing stats, honestly, for the United States. I'll make this quick because I don't want this to be a depressing podcast. 14.3% of U.S. adults right now have type 2 diabetes, and then 38% of U.S. adults have pre-diabetes. So that means if you add those two together, that means 52.3% of the adult population in the United States is currently suffering from what is now being called metabolic disease. So what is metabolic disease? Basically, it just means that you cannot utilize nutrients properly. So you're taking in food. Obviously, you take in food, you eat because your body needs those nutrients to survive. But all of a sudden, with metabolic disease, metabolic syndrome, metabolic deficiency, you cannot utilize those nutrients properly. And then as a result, you cannot convert food into energy. And that is what metabolism is. So if you can't convert food to energy, then it leads to a wide variety of health problems, which is why you end up with all of the symptoms of diabetes. And then, of course, the other health problems that result from having diabetes long-term that we know about and hear about all the time. So we also know, because metabolic disease is a really big deal, all of the things that I just described, you can't just have it affect one system in the body because the body works as a whole. So we know that metabolic disease drives up cancer rates. We know that metabolic disease drives up Alzheimer's rates, which is why Alzheimer's is now often referred to in the literature as type 3 diabetes. We know that it drives up heart disease, mental illness, and many other health problems that Americans struggle with on a daily basis, and those get worse every single day, every single year, every single decade in this country. So before we get into how to not develop diabetes in the first place or to heal from it if you already have it, let's first look at what it is. So what diabetes is a condition characterized by chronically elevated blood sugar levels. So most people know that your blood sugar's just too high, but it's not like it's just too high after one meal. It's just elevated. It's high all the time. And that is due to one of two things, which are either insufficient or ineffective insulin. Insufficient insulin is the result of the beta cells, which we'll get to later, the beta cells of your pancreas not producing enough insulin. So that's insufficient insulin. So you're not producing enough of it. And then ineffective insulin means the body's fat, liver, and muscle cells do not respond effectively to insulin, which is the common term insulin resistance. So those are the two things that are the result of diabetes. And then in a person without diabetes, let's say you eat a bunch of carbs, those carbs in your body, once you eat them, especially if they're processed carbs, they rapidly convert to sugar. And then when those carbs convert to sugar and enter the bloodstream, the pancreas starts producing insulin. So the body is just incredible the way that it works as a whole. So brain senses, hey, there's extra sugar in the bloodstream. We got to do something about it. It tells the pancreas, and specifically the beta cells in the pancreas, produce extra insulin. And then that insulin enters the bloodstream and quickly reduces blood sugar to normal levels. So that is what's supposed to happen, because insulin's job is to shuttle that glucose, that sugar, into the cells. But then in type 2 diabetes, when insulin becomes those two things, insufficient or ineffective, this is when the glucose, the sugar, accumulates in the bloodstream, and you have those chronically elevated levels of blood sugar. And then there's prediabetes. So prediabetes is just used to describe an earlier stage of insulin resistance. And I'm not going to go through the diabetic numbers and the pre-diabetic numbers because it just doesn't make sense to go through those for this podcast. But just know that prediabetes is the earlier stage of insulin resistance. So those two things that we talked about, insulin insufficiency or ineffectiveness, earlier stages of that where the blood sugar is elevated above normal, but it's just not quite high enough to be called type 2 diabetes yet. And then according to the ADA, which is the American Diabetic Association or Diabetes Association, 70%, so listen to these numbers. This is just crazy to think about. 70% of people with prediabetes will eventually develop diabetes. But because diabetes or prediabetes rather, has few obvious symptoms, 90% of the people with prediabetes, they don't even know that they have it. So they're walking around pre-diabetic, right on the verge of becoming a full-blown type 2 diabetic, and they have absolutely no idea because there's really honestly some pretty bad education around this, which is one of the reasons I'm doing this podcast. And then, of course, once they find out, like, oh my gosh, I had no idea. How do I just go from nothing to now I'm type 2 diabetic at the age of 35, 40, 45, whatever it is. And then they're given their one choice, which is metformin or one of the other new drugs on the market. So let's look at some of those symptoms. So first, we're going to start with the most common symptoms of type 2 diabetes, and then we'll look at prediabetes. So with type 2 diabetes, one of the most common symptoms is fatigue. So being tired, and not just tired once in a while, tired if you're lacking sleep, but like tired all the time. Chronic fatigue syndrome, they often refer to it as. And believe it or not, it's the number one reason people enter a doctor's office, I think over the last 2 decades now, is this chronic fatigue syndrome. Like, I'm tired all the time and I don't know why. And it's because of this metabolic disease that we talked about. So when you cannot convert food to energy, guess what happens? You don't have energy and you have chronic fatigue no matter how long you sleep, no matter how much you rest, no matter how much you relax, no matter what you do, chronic fatigue sets in and it just doesn't leave. And then there's increased thirst. You have dry mouth, increased urination, frequent vaginal or urinary tract infections, erectile dysfunction for men, increased hunger for both men and women, Neuropathy is a big one that most people are aware of. That neuropathy is just numbness and tingling in the feet and the hands. Neuropathy is a disorder of the nerves traveling to the feet and the hands. There's blurred vision because of the effect it has on your eyes. And then there's the slowed healing. If you have a sore, God forbid, on your feet, which is often, or on your legs, that can't heal. You get frequent infections because of the body's inability to heal from all of these things that go wrong once you have diabetes. And then, of course, weight gain, which is one of the drivers of diabetes, but it also, once you have it, that increases dramatically. And then you've got the symptoms of prediabetes, which are similar, but again, less known, and some of them differ, which is why 90% of people are walking around pre-diabetic and they have absolutely no idea. So if you've not been diagnosed with diabetes, I want you to listen very carefully, very closely to the symptoms because, again, 90% of people with prediabetes don't even know they have it. So that could be you. That could be your loved one, which is why we want to get this message out to so many people, and we encourage sharing this podcast. 70% of people with prediabetes will progress into type 2 diabetes. So you get 90% walking around, no idea that they even have it. And then of that 90%, 7 out of 10 of them are going to progress into type 2 diabetes. And that's going to be the first time that they find out, like, holy cow, I actually have diabetes. How did this happen? So if your goal is to not become one of those 7 out of 10 people that will develop type 2 diabetes, it's pretty important to understand the symptoms so you can take some action. And then hopefully those actions are to start making some lifestyle changes. Nutridyne is my number one choice for the vast majority of my family supplements. I'm a huge fan of nearly everyone taking what I call the foundational 4 supplements: a multivitamin, a spore-based probiotic, omega-3 fish oil, and vitamin D3 with K2. The large majority of people are deficient in many of these nutrients, and they are the building blocks to gut health, immune system strength, brain health, heart health, and every other aspect of your health. Don't fall into the trap of chasing symptoms with supplements, and instead start to rebuild your health with the foundational 4. We partnered with Nutridyne so that you can save 15% on every order, and not just with the foundational 4, but all of your other supplements as well. Go to foundationalhealth365.com. Click on Shop Brands and then Nutridyne, set up your account, and you're all set to automatically get 15% off all orders. Now let's get back to the Foundational Health Podcast. One of the first ones, again, feeling tired. Just like we talked about with the chronic fatigue syndrome of diabetes, it's probably not as bad at this point because it's not full-blown type 2 diabetes, but definitely feeling tired. And all of a sudden, like you've never had this before, but you just can't seem to find energy. You can't seem to get focused. All of a sudden, your sleep starts falling apart. You just feel like you're hungry all of the time. You really, like, the worse that gets, then the focusing becomes even more difficult. You'll have less, but still have some of that neuropathy, that numbness, tingling in the feet and the hands. And then this is a symptom that's really common, but often not talked about at all. Your neck skin can actually begin to darken. Another one not talked about at all is that you develop small skin tags, and you can develop a lot of those. So when you start seeing skin tags show up and you're like, what the heck? Like, where are these coming from? There's a really good chance you're pre-diabetic. And then, it's time to take action through some of the things that I'm going to teach you later in the podcast. If you do go in and get checked, I am not the person that is ever going to tell you don't take the drug. I'm just going to inform you so you know your choices. But if you do go in, nothing wrong with getting tested, finding out, okay, what are my blood sugar levels at? Where's my A1C at? But then the question is, what are you going to do with that information? Are you going to choose the drug, or are you going to choose to attack it and address it with some simple lifestyle changes? And then just like diabetes, you also have weight gain with pre-diabetes as well. And just as a side note, like recently did a podcast on female hormones. And this is often like a lot of times when women are going through menopause and they're like, oh my gosh, what's going on? I'm starting to gain weight. I'm tired all the time. It's got to be menopause. And certainly, absolutely those hormonal changes and everything play a role, but a lot of times it's also pre-diabetes and type 2 diabetes creeping in because you can have a lot of overlap with those symptoms as well. So let's take a look at why it's so important to be careful of who and what you're listening to. So this is going to be I think it's pretty crazy. And it's just one example, as I mentioned earlier, of the really just insanity with some of the information that's out there. So really important to be careful of who you're listening to, what you're reading, what you're following, because there's just a lot of flat out lies, honestly, around diabetes and so many other topics. And it really comes down to, I look at it as truth versus propaganda. The truth is the studies that are done properly and are not funded by what I call the processed food-like substance industry, as well as the pharmaceutical industry, which absolutely positively show, these studies not funded by them, that is, absolutely show without a shadow of a doubt that we know the cause of type 2 diabetes is processed carbohydrates and sugars from food-like substances, which are commonly called processed or ultra-processed food, even though they're not really food and don't resemble food at all. And these studies are intentionally horrifically flawed, and you will continue to see them over and over as they continue to spread drug-promoting, sugar-promoting, and processed carb-promoting propaganda. It's really what it comes down to. I know it sounds like a silly word and a crazy word, and we don't think of it that way, but that's really what it is. So let's take a look at one of the recent studies just to get my point across here. So there was a 2023 study done that made headlines through mainstream media, of course, as well as the social media world. And the headlines read, "Red meat consumption increases risk of diabetes." If you understand diabetes in any way, shape, or form, you can read this headline and say, BS. That's impossible. I don't care. Like, I'm a huge advocate of grass-fed organic beef, but I don't care if you're eating grass-fed organic beef or the worst grain-fed beef on the planet. It doesn't increase risk of diabetes. It does not cause diabetes. That's not what the science shows in any way, shape, or form. But this is what the headline read. Red meat consumption increases risk of diabetes. So for the average person, they simply look at this headline and then based on their biases, if their bias is like, oh yeah, red meat, I've heard, we should be not eating as much of that or should be avoiding it altogether. It's just going to further confirm their belief that red meat is bad and they're going to stop eating it. And then for those that actually took the time to read the article, not the study, because there's a difference there, it's pretty convincing that red meat is bad. If you just read this overview article that was all over mainstream media. And keep in mind, the articles don't actually go over study details. They just tell you what they want you to hear. So the problem with the studies in mainstream media is that they are almost always nothing more than what they want you to hear, and what they, not to sound like a crazy conspiracy theorist, is the pharmaceutical world and the corporate food world, which are the people that are promoting these studies, funding these studies. So if I were going to explain every flaw in this study, would be here for the next 10 hours because it is mind-boggling how badly it was done. So we're just going to look at some of the glaring flaws here. The study was done on thousands of people, which of course, whenever they say thousands of people, it makes it sound really good because of course, if they looked at a lot of people, then it must be accurate, right? Well, let's look at why it's not accurate. So first of all, one of the many flaws, what they did for this study, this is the extent of the study. They sent out a survey asking people to recall what they ate over the previous 12 months. That was the extent of the study. So that is their study that made headline news. What did you eat over the last 12 months? And then you check boxes and fill in some information from there, which, I'm guessing most people can't even recall what they ate in the last 7 days, much less the last 12 months. So you got a huge flaw right there. And then second, they chose to exclude from this food survey carbohydrates and sugars. Not a choice. And then things like lasagna or spaghetti, or sandwiches with bologna were included as red meat. So just huge, huge flaws and intentional flaws because, of course, they're biased towards what they want the outcome to be, and they know what their outcome is going to be because of how they set this study up. So why would they do that? Why in the world would they exclude the very thing that we know causes diabetes? Well, if you look at the third flaw, the study was done by a group supporting veganism. So they have a reason for the outcome that they want and a reason to then flaw the study on purpose to have it be what they want it to be. And so I am not like, if you want to do veganism, that's fantastic, but just spread truth about it. Like, here's what we see, because there's plenty of pros that you could talk about with veganism and all the benefits of it. And if you're, all about like animal rights, great. But when you start to actually spread lies intentionally, that's when I have a problem with it. So let's talk about a very important fact in all of this. So due to this constant propaganda against red meat and people believing that all of the propaganda, as a result, red meat consumption has gone down considerably over the last 3 to 4 decades, like cut in half over the last 3 to 4 decades. At the same time that red meat consumption continues to drop, guess what? Diabetic rates have increased. So you've got this period of time where red meat consumption keeps going down because of the messaging, and then diabetic rates keep going up. So there's an inverse relationship there. And the reason, and we're talking diabetic rates like have gone up fourfold, so not just a little bit. So why? Why would you have that huge inverse relationship? What else is happening during that period of time? Sugar and processed carbs from food-like substances has increased dramatically. So the very thing that they chose to eliminate from their food survey in this study is what's causing the diabetes in the first place. So just let me reiterate, the reason I'm even discussing this study to begin with is because you're going to continue to see it over and over again. I don't like to focus on the negatives, but it is so important because I realize this because I'm still in daily practice and I hear this on a daily basis from my patients as well as my friends and families and listeners that reach out to me. You'll listen to my podcast. You'll hopefully say like, oh, that makes sense because it's based on truth, not lies. And it's common sense once you really look at it. And it's based on what humans have done for thousands of years. We can't overlook that. They've done it for thousands of years, eating whole food diets, drinking milk, eating eggs, eating red meat with no diabetes. Not like a little bit, but cultures that do it to a massive degree with no diabetes until processed food showed up. And then after the introduction of processed food, that's when you start to see diabetes rates going rampant. If you continue to listen to that message and not be able to decipher and say like, oh, something doesn't smell right there, that doesn't make sense, you're just going to fall right back into believing the lies, which of course is exactly what they want. So they want you to believe lies, that red meat, that eggs are the bad guys, and don't worry about the sodas and the cookies and the processed breads and the crackers and the cakes and all of the other crap that they want you to believe you can put in your body without consequences. So why do they want you to believe that? Because that is what drives sickness and disease. If you drive sickness and disease, you drive pharmaceutical sales. That's just sales tactics 101, and they have mastered it. So they also want you to believe that you're sick and weak and can't heal and function without pharmaceutical drugs, and that couldn't be further from the truth. God's truth is that he created you to be a self-healing machine. We just have to give ourselves the right input to get the right output. So let's talk about how to heal from and reverse diabetes with the right input. The goal in reversing diabetes is to heal and preserve beta cell function. So we talked about beta cells, and I'm not huge on going into science. It's really not that important to understand that the beta cell is what produces insulin within the pancreas. But because the beta cell is what produces insulin within the pancreas, this is what we need to heal and preserve if you're going to actually heal from and reverse diabetes. So that beta cell, what we know is when people eat a high carb diet, you stress out that cell. So the beta cell gets stressed out, and when you stress out the beta cell, it underperforms because high processed carbs cause sugar toxicity in the body and inflammation in the body. So you have these what are called cytokine releases. There's a massive overgrowth of inflammation throughout the entire body, which is why we see all of the symptoms that we talked about earlier. And all of that leads to a very unhealthy beta cell. So the beta cell now can't function as well. It literally starts to reduce in size because of all of this. The good news is that with nutrition alone, you can reset that. You can improve beta cell function. You can decrease the insulin resistance in the cells in your liver, your fat cells, your muscle cells. And the reason that you can do that is because you are decreasing inflammation and sugar toxicity in the entire body. And guess what? That speeds up the healing of the beta cell even further, because now the beta cell in your pancreas doesn't have to work as hard because it doesn't have to try to produce extra insulin. And then the result, the body heals. That's the magic, incredible power of the body, the human body, when you give it the right input. So I have put together a great protocol. It's on our website. You can download it for free. But for the people that don't like to go to my website, that don't like to download things, that aren't tech savvy, let's just do a quick overview of some of the basics of that protocol. So before I do that, let's talk about why I put this protocol together. So on a regular basis, I'm talking to patients. As I said, I'm still in daily practice. And here really is the short version of what I hear on a regular basis when I start talking about diabetes. I was put on metformin or whatever other drug it is. That didn't work, or it worked for me for a while, and then all of a sudden it wasn't as effective. And then all of a sudden, they're recommending glipizide. Now I'm taking 2 drugs, and now my doctor either has me on or wants to put me on something like Trulicity, and I might have the order of these screwed up. I don't really care when it comes to the drugs. That's not my expertise. But I hear that same story over and over again from patients, and they're lost, they're confused, and they're told that they have to be on these drugs or else the symptoms will get worse, or else you're going to lose your eyesight, or else you're going to have a limb cut off, or else you may die if you don't take these drugs. So that is why I put together this protocol, so that people that want to do something differently, and I realize that's certainly not everybody, but hopefully it's you. For people that want to do something differently, you absolutely can, and I promise you, it is not that hard. And this is also, it's a really important point to get across before I start going over this. Absolutely, things like this protocol and other things that I talk about with foundational health, they require some willpower. But it's more than that. This really isn't like it's a willpower problem. So like if you're that person that's like, oh, I've tried this before, I've tried that diet, I tried this diet, and it just hasn't worked for me, I don't have the willpower to stick with it. It's really not what it comes down to. Like by design, these foods are addictive. And the more processed carbohydrates, the more sugars you eat, we know they have massive addictive properties. Your body craves them. So it isn't just like your willpower to avoid them. Your body is craving those things. So the protocol is designed to help you, yes, hopefully have the willpower to avoid them, but so that you can break that cycle and then you don't need that willpower long term. So ideally, you're doing 60 days of strict ketogenic diet with 30 grams of carbs. Now, that isn't probably a very good way to start talking about this protocol because I've probably scared a lot of you off. Now, obviously, if you're a full-blown diabetic and you're highly addicted to these things, as in processed food and carbohydrates, you may need to ease into that, start restricting it, and start reducing it before you go into the 60-day protocol. But once you're doing it, once you've committed to that 60-day protocol, ideally for 60 days, and this is based on science and it's based on healing the beta cells and getting rid of some of those cravings, Sticking with a ketogenic, which means a high fat or high protein diet, a very low carb of about 30 grams of carbohydrates per day. So I'm not a ketogenic fan for life by any means. I'm a huge fan of fruits and vegetables. I am a ketogenic healing diet for the short term when we need to heal from something like diabetes and many other diseases, honestly. So then after those 60 days, that's when you would then move into more of a whole food based diet where you start introducing more whole food based carbohydrates, things like fruits and vegetables, but without reintroducing the processed carbs and sugar. Three really important things to focus on if you're serious about healing and reversing diabetes. Number one, as I just talked about, not all carbs are created equal. Vegetables and fruits and starches from potatoes, whether they're red, white, sweet potatoes, certainly better than others, and some are starchier than others, and sweet potatoes are not as bad as a white potato. But all of that aside, vegetables, fruits, starches from potatoes, and other similar things certainly do not cause someone to become diabetic. Like I would argue, nobody's ever become a diabetic by eating those things. So they don't cause somebody to become diabetic. However, once someone has reached either prediabetes or diabetes, their body is overreacting now to all sugars. And that is why almost all carbs, whole food and processed, need to be eliminated for a short period of time. And you might think like 60 days is not a short period of time, but it is. In the big picture of things, it is a very short period of time. So that needs to happen before you start reintroducing the whole food, healthy fruit, vegetable, potato carbs after the beta cells have either begun to heal with somebody that's severely diabetic or have healed, hopefully, from somebody that's in that pre-diabetic stage. And then what also happens during that process is the cytokine release isn't as strong and the inflammation is being lowered. So other parts of the body start to heal as well. Number two, really important thing to focus on here is the more sick, the more strict. What that means is if you have somebody who's been a type 2 full-blown diabetic for 30 years and they're morbidly obese, clearly they're going to need a longer period of healing and need to be more strict than somebody who is maybe not even overweight and they really don't have any significant symptoms, but they do know that they are pre-diabetic or they're having a few symptoms. There's a huge variance there. So the more sick, the more strict. There's no set guidelines. There's no set rules on this, but the protocol will kind of spell that out as to what you should look for and how you should follow that as well. And then number three, eat to the feeling of being full. So I am a huge advocate of not counting calories at any point ever, unless whatever that works for you, go for it. I'm not a proponent of it in any way. What I am a proponent of is eating to the feeling of being full, listening to your body. Do not restrict yourself. So this isn't about starving yourself. It's not about calorie restriction. It's not about fasting. This is a healing process where your body needs the nutrients, it needs the food, it needs the fats specifically to help heal. So not restricting yourself and do not overeat either. So you want to listen to your body, eat to the feeling of being full. And then number four, eat whole foods. So we've already talked about, but if you've ever listened to any of my other podcasts, I'm a huge proponent of healthy eggs. I'm not going to go through all the details on this, but healthy pasture-raised eggs and unprocessed meats and wild-caught fish, nuts and seeds, healthy fats from things like olives and avocados, and then avoiding like the plague, especially for this, food-like substances. So back to the ketogenic diet. I hear things like this all the time, but I've heard horrible things about the ketogenic diet. And if you put somebody on a high-fat, low-carb diet, what about the increased risk of heart disease? So if you're thinking that, if you've said that, if you heard it from your medical doctor, you're not alone, because it's talked about over and over and over again. The ketogenic diet is bashed. And a lot of that is based on like people thinking like, we're recommending it for life, which some people certainly do. I'm not a proponent of that. But there's a study from a group called Virta, VIRTA. They're a fantastic group, which I don't have the time to go into today, but I recommend we'll link this in the show notes. They did a study. So this Virta group did a study that looked at all 28 different biomarkers of cardiovascular heart health. And guess what? All 28 of those markers improved with people following a high-fat, low-carb diet. So not only did it not lead to heart disease, it actually improved all 28 of those markers. They all got better. And then it gets even better from there, because while following that nutritional approach, all of these things improved as well. So type 2 diabetes, that's pretty obvious. But why? Because blood sugar improved dramatically also in this study. Blood pressure improved. Inflammation came down. CRP and nearly every other marker of inflammation came down. Depressive symptoms improved. Anxiety improved. Sleep apnea improved. Knee, shoulder, and other joint pain reduced, because inflammation is what causes those in the majority of the time. Cardiovascular risk factors, as we talked about, went down significantly. Kidney and liver function even improved. With everything that I've talked about so far, if you've listened to me on a regular basis, you probably have noticed that I have not talked about anything but nutrition. All I've talked about so far and focused on is nutrition, because I do want to reiterate what I said earlier. Nutrition alone, according to countless studies and in my experience, can reverse diabetes. So then if you incorporate things like exercise, that's just a bonus. It's a huge bonus for the people that are willing to do it. And if you recall, fatigue is one of the primary symptoms of diabetes and pre-diabetes. So guess what happens when you start to heal from that? Energy improves. And then exercising doesn't seem so overwhelming. You actually sometimes want to exercise. You feel like you need to move to use some of that energy. So you can make massive changes with nutrition alone, but with a little extra focus on the other 4 pillars of foundational health, with more exercise, better sleep, proper hydration. If you start focusing your intention on health, then I promise you, you will see incredible results in 60 days or less. It might not mean you're fully healed from diabetes if you're like way gone and you've got morbid obesity and you've had it for years, but you will notice dramatic differences in 60 days. And many people can get off their medications with the help of their medical doctor, because it's no longer needed in that period of time. In closing, when it really comes down to it, diabetes is nothing more than a disease of excess eating of carbohydrates and the body's then inability to metabolize those carbohydrates properly because of the overload. Diabetes is not a disease of cells in your body just malfunctioning on their own and needing medication because of that malfunction. Otherwise, they will never function and they'll only get worse. Diabetes is a disease of too much glucose in the cells. Too much glucose in the cells is the result of too many carbohydrates being eaten. And then to go back to that study that I talked about, if you understand basic science, this is why you could look at that study of red meat causes diabetes or increases risk. Fats and proteins don't break down into glucose. Carbohydrates do. So we just know a study like that is BS to begin with. And that is why I keep talking about this stuff, because you're going to be bombarded with all of those lies no matter where you look. So it's really as simple as the old saying, if you don't drink the poison, you don't need the antidote. And in this case, the poison is the excess processed carbohydrates that convert to sugar. And the antidote, of course, that they want you to take is metformin, which is a toxic diabetic drug. Diabetes is also the most expensive disease. This is absolutely insane. And I had no idea until I was preparing for this podcast, but it's currently costing the US government more than $1 billion per day, $400 billion per year since 2022 when they've been tracking this. That's how much diabetes costs the federal government. So insane amounts, but that's exactly why you are told over and over that it's a chronic disease that can be controlled. It can't be reversed because it is their biggest moneymaker. So funny, not funny story that I'm going to share before we close this out. So last night, my wife said, "Hey, what podcast are you recording tomorrow?" And I said, "I'm doing a podcast on diabetes and how to reverse it." And literally, like the second I said diabetes, all 3 of my kids busted into this song. and started singing, I have diabetes, but I manage it well. The little pill with a big story to tell. I don't know, maybe you guys know that jingle. I had actually never heard that jingle. I Googled it today, and it's from Jardiance. So this is just a perfect example of how effective the pharmaceutical marketing is, because my kids watch very little television. We actually have no cable. We don't watch any local stations at all. We don't have an antenna. We just have a couple streaming services. I don't pay for the no ads, which I might start to do after this experience. But it's an example of how effective this marketing is. And if you haven't heard me talk about this before, we're one of only 2 countries in the entire world, along with New Zealand, that allows direct to the public pharmaceutical marketing, which is why we take 70% of the drugs in the world. So it's insanely effective, whether you believe it or not, but unfortunately it has an inverse effect on our health, which is why we're ranked 50th approximately in the world in overall health. So the takeaways for today. Number 1, success equals simple habits performed daily over time. So remember that diabetes did not develop overnight, and you likely have had also some pretty bad lifestyle habits for a very long period of time. So just be patient with yourself. You don't have to dive into the protocol all right away. You don't have to ever dive into it for that matter, but use some of those things that I told you today, where you start reducing the processed carbohydrates, ideally start moving more, incorporating those other things, and then be patient. Give yourself grace, but stay the course. Focus on simple habits performed daily over time. Number 2, diabetes is not a progressive chronic disease unless you choose to continue to eat the poison, the processed carbs. Number 3, you're a leader. Lead by example. Educate those around you. Don't let your kids and grandkids, especially, do not let them believe the lie that the genetics, their genetics, your family genetics are their destiny. You control your reality. You control your health, and you can overcome your genetics with lifestyle. That's an undebatable fact called epigenetics. But diabetes runs in my family. This is what I hear all the time. Well, guess what else runs in your family? Bad lifestyle habits and bad belief systems, but that can change. So I don't say that to make you feel bad. I say that because it's the reality for the majority of people. So be the leader, be the change for your family. If you enjoyed today's podcast and found it beneficial, I want you to think about who needs to hear this message. Be a leader for them. Drop them a text and tell them to check out the Foundational Health Podcast with Dr. Kevin Schultz on reversing and healing from type 2 diabetes. Until next time, make health your hobby. Thank you for listening to the Foundational Health Podcast. As always, if you would like to learn more about making health your hobby, visit our website at foundationalhealth365.com and follow me on Facebook at Kevin Schultz DC Foundational Health.